Hi everyone, it's Renee Jarrett from Not Sorry for the Story with Sarah from Canadian Frontline Nurses. And we are here at day 2 of the Great Canadian Awakening. And Sarah, I heard you mention about a program, an initiative called Connecting Communities to Care.
Yes.
So many of those in my community know that my mom is in long-term care. And before then, we were looking at all options so that would not have been the case.
Right.
But really didn't find that.
Yes.
And so what would you say to those who maybe cannot afford to have someone come in on an hourly rate, or are there alternatives out there? Or not even that, hourly rate is wrong, but just, alternatives to long-term care.
Yes, so that's a great question, because that's a very hard one. We don't actually have the answer to that. When I first started a few years ago, I connected with Stand for Thee, and we created Stand for Seniors, and we wanted to create senior pods, like get families together. And that maybe this is something families can do. Maybe this is an idea, but it's not something we necessarily offer right now.
Yes.
But we need to get families together to invest in a location so that they can be volunteers and help, but also staff can go in, but then they're sharing the costs.
Yes.
This is one of the options that people can do. We at Canadian Frontline Nurses, we want to start looking back into it, because when we looked at it and wanted to invest in it ourselves,
Yes.
we realized that the government was really good at making it like very difficult for private citizens to do it, because no matter how we looked at it, paying the staffing is very difficult, and we couldn't at all make not that we wanted to make a profit for ourselves,
Sure.
but we wanted to make sure that we had enough money, and it didn't work out.
Okay.
It didn't make sense, right? It wasn't going to be enough.
Yes.
And so really, I think that people have to come together, people from the public, and create, just like we're seeing people taking their kids out of school and creating education pods.
Yes.
People can create senior pods. Maybe some people have a location.
Yes.
Well, offer your location and talk to families and get them together and get your senior, your mother, your father into here and share the costs of the staff. I think that is one of the things that people can do right now.
Okay.
But unfortunately, it's not what, we wish that we had that right now,
Sure.
but we're just starting, actually.
Yes.
I think in the future, it will be available. We just haven't figured out how to do it yet.
Yes. I'm ahead of my time, but I know it's coming.
Yes, absolutely.
Part 2 of the question would just be, there are many nurses right now who are leaving the profession because of burnout and also because of the mandates that they have faced. What would you say to someone who has had enough with the system but is looking for an alternative? They still want to care for people. What would you tell them?
I would tell them, please join us. Like you said, we have our Connecting Communities to Care. So we have a directory, but we have to find a way to stop thinking that we need a job, a 9-to-5, and someone to pay us. We have to become independent from government. And when you're in a job, you're creating and building someone else's dream. Like I said, it's all about becoming independent. So you can join our directory and offer care from there and advertise yourself and build a clientele, really build yourself from there. And also on our directory, we have ways where you can give different types of care. Like we have rebates on courses like for birth companions, because a lot of people now, we're all about bringing care back into the community, from birth to death, right? Because giving birth in a community is actually safer than a hospital. So we have birth companions coming up that help completely give birth in the community.
Do you also provide for PSWs? Can they also, or is it specifically nurses?
No, it's specifically nurses.
No problem.
We tried that, but it's too complex.
Sure.
But PSWs, I believe, can go to United Healthcare Workers of Ontario.
Okay.
And they, I think, have all the PSWs. So they can go there and get some help there and see what's accessible there for them.
That's great. Sarah, thank you so much. I know if you have not heard of Sarah and Canadian Frontline Nurses, they have been in different places standing up for not only nurses' rights, but the rights of all Canadians, that we would get the care that we really need for the whole man. So thank you again, Sarah.
Thank you. Thank you
All
so
right.
much for having me.
Appreciate you.